Thanks for staying with us. So Jigawa State is taking a significant step to combat sickle cell disease by making genotype testing mandatory for all couples planning to get married. According to Hamisu Mohammed Gumel, Chief Press Secretary to the Governor, this decision was made by the State Executive Council. The new law requires prospective couples to undergo genotype testing and present their medical reports before obtaining marriage clearance from religious, traditional, or civil authorities. The proposal was put forth by the Ministry of Women Affairs and Social Development, highlighting the state's commitment to improving the well-being of its citizens. What are your thoughts on this? Is this not an infringement to personal freedom? Will this not lead to stigmatization of residents? But you can join the conversation and call us. I'm trying to see the numbers. 0902-416-3440 or tweet us at TVC Connect using the hashtag YourViewTVC. So when I saw this, I was like, it's about time. And I have my reasons because I have seen, I have experienced, I have witnessed, I have been around these sort of conversations. And I've always been of the idea that sometimes some people need to be helped to do the right things for their own sake. But let me come to the ladies. What are your thoughts on this?
I'm of the opinion. I'm of the opinion that government's job is to help. You know, the government carries the responsibility of people's irresponsibilities. So the government must be responsible for the people and create the standard of this is what my people should live like. So there are things people do and they can say it's infringement on privacy. I don't see that as an infringement. I see this as protecting the public interest because your child will become a burden for and a responsibility for my society. So I would ensure that you are properly matched in a way that does not become a responsibility for us. And I think this is a state thinking based on the data they have. Probably they are looking at it that this ignorance or lack of laws have led us to have so many people that are needing, that are living with sickle cell, and it is preventable. There are many things in this world you cannot prevent. Sickle cell is not one of them. You can actually prevent it just by not marrying someone that is also AS. So I feel it is a right move. I know that I know someone that is a specialist. She's a sickle cell. She has like, you know the way you have OBGYN, and then you have those that are specialized in different areas, gynecology and all of that. I just repeated the same thing. But she's specialized in people that have sickle cell. And she talks about, she said she was always grateful for BRF because they created a specific unit for sickle cell people in Lassuth Hospital in the Keja, that you can't even put them in the same, because their immunity is low. You have to keep them in a place isolated. There are many things they require, and this is preventable. So if the governor is coming out to say that, I'm not stopping you from getting married, just don't marry somebody that would also compromise the health of that person, very important. Other countries have put embargo on sugar. Other countries put tax on sugar. Other countries make different rules for their country and their community. I think this is a good move. Thumbs up.
Yes.
Yeah. Let me come to Ramsey.
Yeah. So when I saw the news, I was very happy. I even want him to even add another one to it. That is the number of children you can have. Because those are one of the issues that we have in the north. So I'm very happy that he talked about this genotype stuff, because there are a lot of people who are, you know, in this sickle cell thing. And when I was growing up, I know of you know, some of our friends that had this sickle cell they had this sickle cell issue. There was one time, you know, when they start their crisis, if you see the pain they are in, you understand. So if they are able to make sure that this happens, it's going to go a long way and to stop a lot of people from, you know, having these kids, at least, so that there won't be too many people going through it. Number one of the issues that you have is once you have the sickle cell, it drains the couple. Mentally, financially, physically, everything, And you know, once this thing starts up, have you noticed those people with these sicklers? They are so loved and they are so smart, intelligent. They do very well in school. I know of one of my mom's friend, her son. He had this sickle cell, promising child, you know, and there's this myth that they said that if you pass a certain age, you have crossed it. Again. He passed the 21. We're not like, this guy is. Finally. He was a medical doctor, doing very well and everything. And last, she still lost him. Oh God! And up till today, she has not gotten herself. So if the government can regulate things like this from now, it will really go a long way, and it will help a lot of people so that we can avoid this kind of things from happening.
So, yeah. Amaka, what are your thoughts?
So for me, I'm going to sit on the fence on this one, in the sense that I understand the importance of creating awareness for the prevention of sickle cell, for couples not to get into it, right? For them to make better choices. But the government can't just dish out policies without creating the proper structures in place on how that can be done, or how those policies can properly be effective. Why am I saying this? Number one, the government, have they provided the facilities, the medical facilities, the hospitals, first of all, to even for people to go to when they have something as simple as malaria, headache, typhoid? No, let's be realistic first before delving into this one. Have you created the facilities? Then you've done this one now that you're making something mandatory. You also create the medical facilities, the healthcare centers in all these villages in your states to ensure that this is properly carried out. Then have you also now created a loophole where religious leaders, or maybe whoever it is, the civil service that is going to, that is in charge of a marriage registry, that they don't now extort people, or now people now start bribing them or whatever to get their way, to give them, yeah. So let's be, before we, it's easy to just trot policies and just come up and what structures have been put in place before this policy. It sounds good in the ear. And then it's also important to realize that these are people's fundamental right to love whoever they want to love. So when you're pushing out this kind of policy, it's important to also give them the power of choice and options, in the sense that now, this is 2025.
Okay.
We live in an age where if you're AS and you're AS and you both marry yourselves, you don't have to have a sickle cell child.
Okay.
So the government should also, in making this thing mandatory, also come up with a training section within their medical facilities, where they tell people the options that they have, where they train people on
avoid
if they can afford it. If they can afford it,
Good.
and stuff, and put it out there, and don't just come and push out stuff and make something mandatory. What are your structures that are in place?
Okay, so we have all spoken from, I like the angle that you came with. That is also for the government to see some of the loopholes and see where they can, position and structure properly. But, this selection of sex is for people that have money.
Exactly.
And this state is Jigawa State. What's their earning capital, in that state? What sort of what sort of revenue do they have in the state? How are the people faring in terms of standard of living? Wait, first of all, standard of living, to now say we want to start selecting. But that's also where the government can still step in and say, okay, let's find a way to block some of these loopholes while we do this. So personally, I've been waiting for something like this. And it's not just for Jigawa State. I wish it will go around because I've seen experiences. I've
start somewhere.
In fact, I had an auntie, I still have, she's alive by God's grace, an auntie who has lost 2 children because it was love. I remember when she was trying to get married, I was just getting into the university at the time, and they now found out at that point, before the marriage, that 2 of them were both ASAS. And she was crying. She was crying. She called everybody. No, we cannot, because the guy wanted to break up. Yeah. She said, no, we cannot break up. I am in love. I was in school, young girl. They called me to come and put me out inside relationship that time, that no breakup must happen and all of that. And people were like, hey, don't worry, God will do it. Just believe, you have faith. Her faith is strong and everything. Last, they got married. A few years after they had their child, they lost one. When the other boy was 16, that one happened most recently. Very, like you said, very brilliant boy. High flyer. Smart. They lost him. She was so broken. And I was saying, hey, I wish she saw ahead of time that this was going to happen. She would have just preferred to have left the relationship, for her mental health, for the fact that she brings children. Before they even get to the point of death, the pain they go through when those children have crisis.
Oh God.
I did not feel the pain, but from their mother's eyes, you will see the pain that they feel. Sometimes government, like you said, takes care of our irresponsibility, and that's why they are government. So, like you rightly said, they may have checked the data to see, true, we don't have the capacity to give all of these options right now. How do we help our people? But many people will say, and Amaka pointed to it, that this is an infringement of the rights of the citizens. How do you think governments can make policies, you know, that work for the citizens without actually infringing on the citizens?
So I think that
the citizens' rights.
I think that it is impossible for a government that wants to channel the citizens into maybe a goal, and if you set a goal, you will need to suffer a bit to achieve that goal. There's nothing worthwhile having that will not cost you something to have it. So for every time there is this ambition that, oh, we want to start this business, or we want to become the #1 in having science, we want to have the highest number of scientists in the world, we want to go to space, it will cost something. Some citizens will feel like, I don't want to study science, and then the government says everybody must study science because we want to be able to find out which of you would help us get to space. Somebody can feel like it's infringing on my, why must I do this? NYSC, somebody can say it is infringing on my private, I don't want to go to NYSC, why must I go to NYSC? But it is the law. Oh, anything that will bring order will bring a bit of discomfort to align with that order. And somebody can feel like that discomfort is infringing on my privacy. So if government wants to achieve their goal with a sense of humanity, yes, you would have to focus on your goal and explain the reason for the suffering people will go through. When they are fixing road, I can say, I cannot rush to where I want to go to. You are infringing on my right of movement when they block the road. But if I explain to you, why am I doing this? It's because I love you and I want to have a better life. So what government owes us is to detail the explanation of how we would enjoy the benefit of this slight discomfort in future.
Yeah. We'll take a short break here. When we come back, we'll continue the conversation. Stay with us.
Stay tuned. Your View will be right back.
Thanks for staying with us. We're still talking about the new policy in Jigawa State.
Like, I want to respond to what Tobe said. Yes, the government has a right to, correct or help our irresponsibility. As I said, I'm sitting on the fence. I agree. But what policy, when you just push out policies, what structures? I'm not seeing any other thing that followed that news. Like, what else are you saying? How are you educating the masses, right? How are you, do most of them even understand what AS or SS, what it even means? What structures have you put in place? What are the hospitals? What do you even have, does Jigawa State, the village in Jigawa State, do they even have healthcare centers?
Why they should not go and do SS and be having crisis? They'll just be dying because there's no place for them to go to.
Before you start something, make sure that you've already...
There's a framework.
There's a framework for that policy to stand on. If not, it will just be like you're making noise, just like any other time. Even Jigawa State, it will just crumble.
I agree with you, Amaka, because I know that. But you see that educating them, first of all, it's better to start, with this
the policy
first,
and then educate.
Before you now start educating, because no matter how much you explain, they will not understand. Like, people will look at it like, you don't want them to have kids, or you don't want them to marry the people that they like and everything. And they will tell you that it's God that will protect the child and all of that. So it's good as he's making this law stand. And when it comes to health, I think any law, if it's going to protect anybody, I think any law is fine, any policy is okay. So let's look at these two scenarios. The only thing I can say is he can add a clause to it. Like, for example, he can say, okay, if you have AS and this one has AS and you guys really want to, be together, you can decide not to have kids. That's another clause. So they can come, they will sign and say, okay, we can't have kids. You can adopt. You can adopt. You understand the hair. So I now thought of it like, okay, for example, now I have maybe an employer of labor and I have somebody working with me, and the person has a child that is a sickler. You can imagine that parent will not give me their 100%, because I know a lot of parents who have had kids that are sicklers. Man, it's draining. It's terrible. It's draining, and also you can imagine that parent will not give you 100% at your place of work. And anytime the child has issues, you have to let that parent go. You won't sack the parent. You say, okay, go stay with your child. And once that crisis is on, they are in the hospital. You'll be in the hospital. You can be in the hospital for 3 weeks, a month. You are there, trying to get well and all. So if we can start this way, it's a good step.
Yeah. So I like that too, because we've always advocated here that let's not just copy and paste policies. Let's look around us. What will work here what Ramatu just said now is understanding the people of Jigawa State to know that advocacy, they will not listen. They will not understand what you are saying. They will feel you just want to scatter things for them. It's better that you start with the policy. So as they are seeing there's okay, this is not allowed, this is against the law, then they can now pay attention to, okay, why are you insisting that we do this? So I think the government sort of understands the people that they have. Yeah. My worry is implementation, like everybody has rightly said. Are they willing to implement? We have many fantastic policies in Nigeria. Many good, you hear, so this is a law, oh, this is a law, oh, we have this, we have that. But when it comes to implementation, it's as if we just write the thing and we abandon it. Everybody just faces their corner. Have they thought out how to implement this? Have they thought out how to even at least make the testing free in hospitals? Everybody go and get your status of your genotype, you know. Have they thought out how they are going to follow through, even those that they find guilty? What is going to happen to them? Do they have this all sorted out, or they just sat down together, okay, let's just do this and see how it goes? That's usually my fear when it comes to these policies. But I think we have practically, okay, we have a caller on the line. Good morning, Abdul.
Good morning, how are you?
I'm fine, sir.
Okay, regarding to this topic, I actually lost a sister to sickle cell. And once you've been through this, you don't wish it even onto your worst enemy. Now, we cannot hold the government responsible for everything that happens. Nigerians also have to take responsibility. So kudos to Jigawa State Government for making this statement and following this thing through. We have to start from somewhere. You understand? Now, I know in the North, there's a lot of awareness about sickle cell. Unfortunately, we have a lot of uneducated people in Nigeria. What the government can do, as one of your panel ladies said, the lady wearing black, I can't remember her name, is to bring awareness regarding this thing. This is a black man's disease. It doesn't affect anybody else. And the government are doing the right thing, especially the state government are doing the right thing for bringing awareness to this. From Jigawa, the government, federal government can look at this from Jigawa, see how they can implement this nationwide.
Okay.
But nevertheless, education is key. We have fantastic doctors and nurses that knows about this thing. And especially in the North, in Jigawa, where I know the state very well, the state governor is doing the right thing by saying that if you want to get married, we need to know your genotype. Why? And that they're doing it through the traditional leaders and state chairmen or so, who are very powerful, who are very revered in the North. So kudos to the state governor and Jigawa State. We have to start from somewhere.
Yeah, thank you. Thank you so much, Abdul.
You're doing a good job from starting.
Thank you so much, Abdul. So what I also see here as we're wrapping up, ladies, if you want us to wrap us up. What I also see here is, you know, when we hear, I'm in love, we always lie to ourselves in a way that there are certain things you will see from the beginning that you will not fall in love. From the beginning. If you had that conversation on the first date, there won't be any room for love to grow. So as we're meeting for that first lunch in that eatery, where you're buying me meat pie, I
shared it now. My husband, my husband is
You are
it
dropping,
was the first few questions he asked me.
What's your genotype?
Let's take
As
it out
part of the questions, yes, we're asking ourselves, getting to know ourselves. What's your genotype? What's your genotype? From that first date, we know whether we should see on the second date or not. So we don't have issues of, I am so in love, I cannot let this person go. So that is why advocacy is very important. The government needs to do more advocacy. Yeah. People need to keep talking about this so that you know from the beginning that this is a no-no.
Yeah, I totally agree because, you know, I come from a home where my grandmother was AS, my grandfather AS. So I have uncle and aunties that were sickle cell and we lost them, right? And so I am AS. And since I was a child, my mom, my dad, they're very particular, like, oh, you know, you can't marry someone that is AS, or when you meet somebody, that's the first thing. So it's at the back of my head that when I go on a date, or if I meet somebody, the first question I'm going to ask you
what's your genotype?
Is what's your genotype, because it's important to me to know if I want to take the conversation further. It's just somewhere in my mind. But then with this day and age and with things, that doesn't really matter anymore because things have gone beyond that. That is for me. But then, that's what I said, that's for me. But then, like I said, it's important to create policies that protect, but you need to also educate people about what it is you want to protect. Because if I don't understand that the policy is meant to protect me, I'm going to fight the policy because I don't know. I just feel like that you're trying to prevent me from doing just doing the bare minimum, which is finding love, than protecting my health.
That's also why if you don't explain, like you're rightly saying now, many people will take advantage of the situation where I go to the hospital and then they can falsify the genotype
because nobody understands.
So, and I'll take it just, Shebi, they say we should present genotype. This is what I'm presenting. But if you are aware, you will not go to a hospital where they will falsify it for you, because you need to know your status and the status of the person you're getting married to for your future. Thank you, Nakolabo, honestly. Thank you so much for your contributions. That's all we can take on this topic. We wish the Jigawa State government success in this their policy, and we hope that it is well implemented. It is well thought out and well implemented. And when we come back, we'll move on to another story for today. Stay with us.
Stay tuned. Your View will be right back.